Welcome everybody to another seminar on German New Medicine with the lovely Dr. Catherine Willow. German New Medicine is fascinating and I'm very happy to be co-hosting this with her. We'd like to just start this evening with a little short sound meditation, just an opportunity for us to get really present and grounded in our bodies and really can get in touch with ourselves. So if you want to just take a moment, take a long, deep breath.
Thank you. That was lovely. Do you want to introduce yourself, Rebecca?
Sure. I'm Rebecca White Raven. I am a sound healer in Ottawa and a big fan of German New Medicine.
Thank you. All right. So then I'll introduce myself and our healing center. So I'm Dr. Catherine Willow. I'm a naturopathic doctor, fourth generation in my family via Germany. And I graduated from the National College of Naturopathic Medicine in Portland, Oregon in 1983. So a few decades under my belt. And I I founded and direct the Carpridge Eco Wellness Center. So we have 190 acres near Ottawa, and we have a holistic clinic with a group of practitioners, and we all work together. And we have a healing house, which is a bed and breakfast with organic beds, organic food, in nature, where people can come for a healing stay, where they can get an integrated program through all these different practitioners, which also uses German New Medicine. So it's a very unique place in North America. We run other programs there as well, some yoga, meditation. We have spiritual programs running, and the land itself is absolutely beautiful and healing. So we have trails and opportunities for people to come and be nourished by her. So what we're going to cover in this talk is we're going to start with a startling case. We're going to review the basic principles of German New Medicine, applying them to joint pain. And we're going to then complement that with how joint pain is understood in naturopathic medicine and Ayurveda. So then we'll go from that understanding to the obvious treatments that we would use with case examples. And after that, we'll give you resources that you can follow up on. And at the end, we'll have a question and answer session, followed by a chime meditation with Rebecca, or sound meditation before we finish. So we'll start with the startling case. So joint pain has been one of my favorite things to practice since I was a student. So this was one of the cases we saw when I was in my third year at naturopathic college. So a middle-aged woman came to us, 2 crutches and medications, and her knees were swollen, literally this big. They were huge. And her medical doctors had said, there's nothing you can do. You're on drugs for life. And don't listen to people who can tell you food will make any difference. So we assessed her and gave her a program that alternated cleansing and building, and gave her a lot of encouragement, saw her every week. And within 6 months, this woman's knees were back to normal, no drugs, no medications, and she was enrolled in dancing classes. And she taught us, oh my gosh, what's possible. So it went from there. And later, as I studied the German New Medicine, I realized that the key point from German New Medicine was all the encouragement and emotional support that we gave her. But she really felt valued by us and cared for by us. So the background of German New Medicine starts with Dr. Hammer. And because it sounds like most of you have this background, I'm only going to acknowledge that this man was absolutely brilliant, a medical internist in Germany who, through his own experience of losing his son and then developing testicular cancer, started making the connection between shocks, brain scans, and physical manifestations. And through his very astute, careful observations, noticed new patterns that we had never seen before. And that's what we'll explain today. And so now we have German New Medicine practitioners all around the planet, and it's growing exponentially as people find out about it. My own background, similarly, is based in loss. My second husband, Mickey, developed brain tumors, and we went the naturopathic route at first, should have stayed there, but because we had the old understanding of cancer, like it just keeps growing, and just imagine this eating the inside of his brain, we also went to medical treatment and had him have brain surgery. It was after that a patient handed me Dr. Hammer's first book, and I ended up reading it on the way to Germany for treatments. And it was 1 o'clock in the morning over the Atlantic, and I still remember my hair standing up over my whole body, thinking this is not just a new treatment, this is a whole new way of understanding cancer and other diseases. And got to Germany, looked up Dr. Hammer. We sent him Mickey's CAT scans, and he told us heart, kidney, left testicle are affected. Those are related to the 3 tumors. And Mickey said, nothing wrong with my testicle, and we ended up losing him. And it was in a way, a very enlightening experience, because even though we had been introduced to German New Medicine and the principles, we were both so frightened that we couldn't use it properly. So always remember that when I see new patients and they have a cancer diagnosis, and not to expect people to be able to digest this easily. So now we always recommend that people study on an ongoing basis if they want to use this as a patient. because that's your main foundation, if you're using German medicine, is the understanding, because it's that reframing that then leads to the body doing something different. So anyways, after Mickey died in 2002, we had an autopsy done, and it proved everything that Dr. Hammer had said, even down to a totally necrosed or ulcerated left testicle, which had been asymptomatic. So he didn't know that. That happens without any pain. So after that, I studied it for a year with a lot of questions, feeling like if this isn't real, I'm going to be killing people. And started using it in my practice in 2003 with enormously good results. And finally was able to publish a book with a lot of the cases last summer, with the encouragement to the medical practitioners, you guys need to research this, because to really integrate this into our medical system, medical doctors have to do the research to prove that it's real, and then we can start integrating it. And I continue to study under Ilsadora Laker, who's my teacher. Okay. So Dr. Hammer consolidated the basic principles under 5, what he calls biological laws. So we're going to go through these laws and relate them to joint pain. So the first law is that a biological shock will create a lesion in the brain, which will then result in a response in the body. And it's actually simultaneous. And the lesion, so biological shock is something that hits us on a primitive level. It's an unexpected, fairly extreme shock that pulls the rug out from under us. And the lesion in the brain looks like a series of concentric circles, as if you threw a pebble into a pond. And the response in the body is very specific to how we have responded to the shock. So if we respond with fear, it could be one organ. If we respond with anger, it would be another organ. So fear, let's say fear of death, would affect the lungs. Anger might affect the digestive tract. Fear of losing money or starvation would affect the liver. And devaluation is what affects the joints. So we'll go into that. That's what we're going to go into in this webinar. I also want to mention the handedness rule. So Dr. Hammer discovered that the type of relationships which cause us shocks correspond to one or the other side of the body. So our dominant side, for most of us right, but for left-handers, the left side, relate to what we call partner side. It's all the people who are really close to us, except mother and children, that they would relate to a non-dominant side. So for instance, we can do the joints. I don't have a one-sided joint, but for Dr. Hammer's testicular cancer, that was only on the left side, because he was right-handed and he lost his son. Or for me, after I lost Mickey, after I started healing from it, I had eczema on the right side of my rib cage. And I'd never had eczema before. And in German New Medicine, eczema is the healing phase of a separation. And where the eczema is a clue as to where we were touched. So that's where Mickey would always hold me when we would walk around the property. So it was like a hand-shaped patch of eczema. So it's very interesting. And so that's the first law. So where the shock, a devaluation shock hits, is in the medulla part of the brain. So that's in the new mesoderm. So what these, you don't really need to know these unless you're studying German New Medicine as a practitioner. But what it means is that these relate to the embryological layers that were laid down when we were in the womb. And these connections between the brain and the tissues last our whole life, of course. So here in this example, you'll see in the medulla that there's a picture of a skeleton. And so there's a very orderly system of where shocks hit depending on which joint is being hit. So in this case, those circles, those brain lesions, are hitting the shoulder. And I'm just going to take a bit of an aside here. When there are two shocks in the same brain level on the opposite sides, because that would create a massive stress for the body preserves itself by pushing those up onto a mental level. And all of these symptoms that the body has are meant to help us. And this includes the mental symptoms. So we're not going to go into this, but I want to mention that the constellation, which is the name of these mental symptoms, for two devaluation shocks, is a megalomania. So in other words, the person feels overly good about themselves to compensate for not feeling good enough. And I think I know I have that to some degree. I think it's quite common, but it depends on how extreme it is to where you'd actually call it a megalomania. And what happens is that the body preserves itself and creates this mental symptom in order to preserve us, to preserve our self-esteem until the situation is right to heal the self-devaluation. And then these lesions heal and our megalomania goes away. So I'll just leave that for now. We'll do another webinar on constellations. It's quite a lot more complex. So let's look at the different kinds of devaluations that can lead to joint pain. So I'd like to start with a generalized devaluation. And I'm going to read this out. This comes from the website Learning GNM. And it says, a generalized self-devaluation conflict concerns the whole person. The conflict is experienced, for example, through humiliation, accusations, scoldings, derogatory remarks, abuse, physical, sexual, verbal, failure at work, at school, in sports, in a relationship, as a parent or partner, a poor performance, intellectual, artistic, athletic, or feelings of shame and guilt, the loss of a status, the loss of a workplace, retirement, illness, or injuries. I am out of commission, aging, I am not as good as I used to be, I'm getting old and useless, or the loss of a person who made one feel appreciated and needed are other conflict scenarios. The way we perceive ourselves or speak to ourselves, I am a failure, I will never succeed, create mental predispositions for generalized self-devaluation conflicts. Children and the elderly are more vulnerable to suffer the conflict. So I thought that was such a good summary of what devaluation can be and how common it is. And of course, all of these things don't inherently cause self-devaluation. It's how we respond to them. So I'd like to tell you a case that underlies this. It was a fascinating case. It was a young woman who came to me with joint pains all over her body. And as usual with German New Medicine, we ask, when did this start? And dramatically, she said, at my husband's funeral. And she had assumed, of course, that this was due to grief. And she had her mother with her. So I said, you're assuming that this is due to the loss, due to the grief. And I said, it's not. It's due to relief. In this relationship, you felt devalued in every part of yourself. And she looked at me and her mouth dropped open and she and her mother looked at each other. I want to cry just remembering this. And she said, absolutely true. So you'll see why the timing was such when we go into the second law. But let's look at some of these other joints. So we'll go from top to bottom. So the neck joint is usually related to an intellectual self-devaluation. So this can happen if we're not good at school, or we're put down for not being smart. Maybe we have a learning disability and it wasn't treated respectfully. And we go into life being very prone to feeling devalued intellectually. Shoulders relate to, I'm a bad partner, I'm a bad parent, feeling guilt or shame about not being there for the people close to us, or I'm a bad daughter or son. So daughter, son, child would be our non-dominant shoulder. Everybody else is on our dominant shoulder. Elbows, hands, wrists, fingers are usually related to performance. So I had one of my first arthritis case after I learned German New Medicine was a man who came with arthritis only in his hands. And that's a very interesting point in itself, because in naturopathic college, we're taught that arthritis is a metabolic disease. It's related to deficiencies, it's related to toxins, it's related to, to internal things. So why isn't it in every joint? So German New Medicine explains why it's only in certain joints. And with this man, I explained to him that with hands, it's usually a performance shock. And he startled for a moment and said, that's exactly what happened. I work for this big company. I considered myself fairly high up and very competent, and out of the blue, got a bad performance evaluation. And it shocked him. And the joint pain didn't start right away. And I'll explain that in the second law. But the joint pain eventually came. And of course, the joint pain itself, and we'll go over this, we'll mention this over and over because it's the key to arthritis, itself causes a feeling of devaluation because you can't perform as well, you can't type as well. So it's what we call a hanging healing. And I'll go over that. And so once we identified all that so clearly, I said to him, well, you need to slowly wean off the drugs because the drugs lock it in, and realize that, your performance is fine. And within 6 to 8 weeks, this joint pain will resolve and you will have healthy hands again. And at that point, I didn't really integrate any naturopathic things. I just said, just do this. He was totally compliant. And that summer he was playing golf for the first time in 5 years since he'd been diagnosed. So that gives you a sense of how this works. And as we go through the laws, I'll tell you the mechanism. Then we can go down the spine. So the thoracic spine is, take my cheat sheet here, a central self-devaluation conflict that shatters the core of oneself. So humiliating and degrading treatment. The lower back is also associated with feeling unsupported, not backed up. by a family member, partner, friend, teacher, colleague, or employer. A cancer diagnosis related to the area of the thorax or the lumbar spine, or constant pain affect the closest vertebra. The pelvis and pubic bone relate to sexual self-devaluation, and the hips relate to unbearable stress, not being able to endure a situation because of unexpected or continuous demands. This is too much to carry. I can't manage. I can't get through this. Knees and lower legs, physical performance conflict. For example, difficulties walking or climbing stairs, not being able to keep up, a poor performance in sports, let's say having lost a game, being put on the reserve bench, humiliating remarks by an instructor, not performing up to our standards or the expectations of a coach, parent, or spouse, feeling less mobile during pregnancy or because of having gained weight. I also noticed, because I went through knee pain at one point, and my teacher mentioned that it was also resistance, that you lock your knees to resist moving forward. And that was mine. I had acute knee pain. And through working through my resistance, it resolved totally without any other treatment. So it's, as you can see, it's very important to find out what the individual's stress is or issue is in order to heal. So feet, ankles, heels, and toes, not being able to walk, run, jump, dance, or balance. Also, not to being able to kick someone away in defense. The underside of the heel is linked to not being able to crush a person or a situation. So there you have the different types of devaluations related to the joints. At this point, I should also mention that in these brain relays, it's not only the joints that are represented by the skeleton, it's also the bones and the cartilage and the nerves, the nearest lymph nodes, nearest the skeleton. So on a CAT scan, you wouldn't be able to see it clearly. You have to go by the symptoms. Also, blood vessels are in the same brain area and lymph vessels. So then here's the chart that Dr. Hammer conceptualized to explain German New Medicine, where this is, so in the top part of this graph is one part of our nervous system, which is the sympathetic nervous system. It's our fight or flight nervous system. And on the lower part of the graph is our parasympathetic nervous system. So the rest, restore, rejuvenate. So in our day, we get up in the morning and our cortisol kicks in and we're more sympathetic dominant. And then around 4 or 5 o'clock, we start getting tired and we slide into parasympathetic dominance, hopefully go to sleep early. In that sleep, we can repair as long as we sleep early enough. And then gradually we come back out of it in the early morning and get up, and we keep doing this day and night until we hit a shock. So in the German New Medicine system, a biological shock is called a DHS, and that stands for Dirk-Hammer syndrome. That was the name of Dr. Hammer's son, so it's in honor of him. So the first state, what happens immediately after a shock, a deep shock, one that affects us on a survival basis. So it's our survival or that of somebody close to us. And there are 2 levels of symptoms. The first symptom is general fight or flight symptoms. And that would be feeling shocked and tending to want to isolate in that shock, cold hands and feet, shutting down of the digestion, which may lead to loss of appetite, and sleep disturbance when we're in shock. And the sleep disturbance is that we wake up too early in the morning, 4 or 5 o'clock. And the biological significance of that is that our brain wakes us up early so that we can focus on the problem and have time to resolve it. Because sometimes in our daily lives, we're too busy to do that. I'm going to leave that here. So, because I'm going to go, because there's also the specific organ symptoms, but I'm going to go into that more in Law 2. So I wanted to also put up here a couple of hair analysis charts or reports, because I do this now with every patient, and it helps me understand what's going on in German New Medicine as well. So here on this one, this was a little boy who hadn't been growing, so related to bones, related to connective tissue, and his potassium and sodium were off the chart. Normal is in the hundreds, his were in the thousands. And those electrolytes are mediated by the adrenal gland. So it showed enormous stress, which of course shuts down a lot of functions in the body, and especially our ability to absorb nutrients. So I often find when people have arthritis or joint pain that they'll have this level of adrenal stress. And what happens over time is that the adrenals then get tired and don't produce cortisol very much, so that then this goes low. And cortisol is an anti-inflammatory. So when we don't have enough cortisol, we have allergies, we have inflammations, and of course the joint pain is going to be worse. On this one over here, we have a high magnesium, and usually actually, we didn't pick a good one. Usually we have the magnesium and calcium and strontium and barium all high together when a person's too acidic. And that will leach the minerals that we need for bones and joints out of the body. The specific mineral for joints is also manganese. So we'll look for low manganese to help on the nutritional side. So let's head into the second law, which is especially important for joint pain. So Law 2, in Law 2, Dr. Hammer discovered or summarized that every shock has two phases, or potentially two phases. There are two phases if there's a resolution to the shock. So in the first phase, it's as I pointed out, you go into fight or flight. You have the sympathetic nervous system being dominant. Plus you'll have specific symptoms of the organ or tissue that's trying to help us with the shock. So there's someone who wants to be admitted in the waiting room. I don't know if I can do that, so I'll let you do it in case I mess something up. So what Hammer observed, again with that acute mind of his, astute mind, is that when people observed their shocks, that they would go into a whole new set of symptoms. And that would be fatigue, water retention, often warming up. In the active state would be cold, in the healing stage would be warm, and a relaxation out of the shock, being able to sleep again, being able to eat again, and also a specific change in that same organ that was affected. So here's where we find out exactly the mechanism for joints in German New Medicine. In the first phase, you won't feel anything in the joints. They're asymptomatic. And in the second phase, you have inflammation. So if you haven't already guessed this, joint pain is in the healing phase. That's with that young woman at the funeral. She was starting to heal immediately. Now, usually that healing takes 6 to 8 weeks. But what happens in so many cases of joint pain is that we get triggered back into active phase and don't finish our healing. And there are two kinds of triggers in general. One is the trigger similar to the original shock, i.e. a devaluation. And the second one is the trigger by the pain itself that also makes us feel devalued. So it doesn't let us heal. The other thing that doesn't let us heal is very interesting. It's that assumption that this is a disease. And it's almost like we lock that in by the belief that this is a disease, as opposed to the understanding that this is a healing process. The other thing that can lock in joint pain is drugs, because the drugs, being anti-inflammatory, don't allow the inflammation to finish its healing process. So it's very important at some point to wean off the drugs, if need be with the collaboration of the medical doctor, whoever prescribed the drugs, in order to finish the healing. So now we can go further into this chart. So here we have normal daily life. Here we have a devaluation. Here we have sympathetic nervous system symptoms, so shock symptoms, and asymptomatic joint process. And what happens there is that there's a necrosis or an ulcer, tiny little holes happen in the joints. I'll explain that more in the next law. Then if there's a resolution, we go into the healing phase, which is into the parasympathetic nervous system, part A and part B. So the part A is when you have water retention, you have fevers, you have great fatigue. And then when there's enough healing that's taken place, the brain will spike a short period of sympathetic activity. And in homeopathy, this is that return of symptoms. During that sympathetic spike, which we call an epicrisis, you'll have a return of symptoms from the active phase. And of course, in some programs, you won't notice the epicrisis very much. For instance, with the joints, because they were asymptomatic, all you might notice is a period of stress, of not being able to sleep, of all of a sudden feeling anxious, or however you felt in the active phase. That will stop by itself. And then the second phase is when there's the repair finishes itself, the excess water is peed out. So people often call this the pee-pee phase, and gradually we return to the normal diurnal rhythm. Stronger than ever. The joints are stronger from this experience. Law 3. This is my favorite law. This is absolutely the most startling principle to learn about healing. So this law tells us that depending on which brain level is affected by a shock, it'll determine the pattern that happens in the body. And the patterns between the old brain and the new brain are 180 degrees opposite. So in the old brain tissues, and these are tissues like the lung, the digestive tract, the kidneys, or part of the kidneys anyway, the lower skin, the corium. These are tissues that are more related to life and death, and they respond to shocks of life and death. And what happens in the body is that the tissues or organs grow in the active phase, and they're trying to help us. For instance, in a lung cancer, that's the response to a death fright. When that death fright is over, this tissue will stop growing and go into the healing phase. So for an example, we had a lung cancer patient who called me and said, I have a lung cancer. They want to take out 1/3 of my lung. Can you help me? So now with lung cancer, one lesion is fear of death for somebody else. Several lesions is fear for oneself. And the biological reason for the lung responding to a death fright is to get more air into the body, because that's our primary requirement for life. So the lung will grow more cells to get more oxygen into the body. So I asked him, is it one lump or many? He said, it's one lump. And I immediately said, is someone close to you dying? And he said, no. I said, well, recently? No, my mother died 3 years ago. So then I knew that that lump was no longer growing, because I know this isn't related to joints, but it's very interesting. Because once that person dies, we're no longer afraid that they're going to die. It's done. There's no longer any need to have any more oxygen. So I said, oh, so you don't have any symptoms then? And he said, no, it was caught on a routine x-ray, but I have tension on my right side of my chest. And I thought to myself, well, he's probably right-handed. The tension, the lump should be on the left side. And I said, isn't the lump on your left side? And there was a pause. And he said, how could you know that? That's how solid these rules are. So I said to him, this lump is no longer a danger to you, but you don't have to do your treatment, but you have to learn why I'm saying this. And this is a very crucial point. You can't just tell people, oh, do this or do that. German New Medicine comes from the inside. You can't do it to someone or for someone. It has to make sense to them, and they have to be motivated and want to do it. So I said, come to a class, look at some websites. And he came and it made total sense to him. He saw me once and I said, you're so healthy, go back to work. But I said to him, have a scan done once a month. Don't break connection with your medical people. And you'll see that it's not going to grow. So the next thing I heard, he was at the Mayo Clinic getting a second opinion. And they said, not only take the lung out, but do chemo and radiation. And he was in a panic. And I said to him, well, do you have symptoms? Not a one. Has it grown? Not a millimeter. So I said, well, you could do the treatment if you want. You can never tell people what to do. And you could wait. So he decided to wait, and he came back and he called me the day later and said, my surgeon called me and yelled at me for an hour. You're going to be dead in 3 months. I've seen this so often. And I said, you're really healthy. You're really strong. Do you have any sense that, that this could be for you? And he had to admit that it wasn't at all. So I said, you can do the treatment at any time, and you can also wait. Anyway, he just, he went without the treatment, went back to work, and I call him every few years. He's still alive, and he's better than ever. And so you can see from this how profound German New Medicine can be and how startling the results can be. And of course, this works right in line with naturopathic medicine, homeopathic medicine, because we just facilitate this process. Now, let's get to joint pain. Joint pain is a new brain pattern because joints are governed by the medulla, which is in the new brain. And here, the tissues ulcerate or lose function in the active phase. So as I said, depending on which joint gets hit, depending on the type of devaluation, and depending on how deep the devaluation is, that will tell you, that will manifest itself in a more severe case. But you won't feel it in the active phase. While you're in the devaluation, that ulceration continues without you knowing it. All you'll feel will be the stress of feeling devalued, the sleeplessness, the digestive upsets, the cold hands and feet. There's another new brain pattern as well, and that's related to function. So the tissue itself doesn't grow or ulcerate, but it loses its function. So diabetes is one example, and MS is another example, but I'm not going to go into that this time. What happens when the devaluation is resolved is that the tissues in those joints start to repair. And part of repair is inflammation. Like if you have a wound, a cut in your skin, at one point you'll see that it gets puffy and red as part of its healing. And that's the similar thing for the joints, except it just takes longer. It takes 6 to 8 weeks. And you can have an exasperation of that healing if you get something called a kidney tubule syndrome. And I should have made a separate slide for this. This is when there's a conflict that affects the kidney, which causes it to hold water. And there are 3 types of conflicts which cause the same thing: abandonment, existence, and refugee. And all of them are about losing your close people, not to death, but being separated from your close people. And the kidney will close down to some extent, retain water, because that water, if you think of ourselves in primitive tribes, let's say we're separated from our tribe and our kidneys retain water, we can walk longer to find our tribe. It's something like that. But in this case, what happens is that water, which is retained in the kidney's active phase, goes to where the body is healing, because the body naturally retains water in places where it's healing. So that extra water will be added to that. It will increase pain, swelling, and redness. So that's very important, because then on the emotional level, you need to identify and treat and calm down those fears. So now we have more of a complete picture. So again, we have the normal, sympathetic, parasympathetic. We have our DHS, or biological shock, which is a devaluation. In the active phase, we only notice the fight or flight symptoms. And here in the red, which is the new brain, we have tissue loss, that ulceration, those tiny little ulcerations in the joint. If there's a conflictolysis, that's the CL, which means resolution, our nervous system switches into parasympathetic, first phase, where there's swelling because of water retention, pain and inflammation as part of the healing, great fatigue, and this fatigue is not to be discounted. It's actually quite frightening for people if they don't understand that it's healing. The fatigue itself can make people feel like they're sick and then escalate the hanging healing, because again, we feel devalued. In our culture, it's so focused on achievement that when we can't achieve, when we're too tired to do things, many of us, me included, feel devalued. We devalue ourselves. Oh, I'm lazy. Oh, I can't do this. I won't be admired. I won't be successful. So it really brings up all of our core issues to use German New Medicine for our conditions. So we have in the healing, we have the fatigue, the pain in the joints. And if we understand what's happening, if we have good support, if we have good common sense, we'll go through the epicrisis as a moment of fight or flight return, and then go into the second phase, have period of increased urination where we're excreting the water that we held to heal, and our energy starts to return and we come back to normal. And those joints are like a broken bone. You know that when our bones break and they heal stronger than they were at the beginning. So the biological purpose of this whole program is to strengthen the joints so that we function better and we're less prone to being devalued. All right. Law 4 is not, I have not found this so necessary to understanding joint pain, because I don't usually see infections as part of joint pain. It does happen, but it's mostly inflammation. But in German New Medicine Law 4, microorganisms are always part of healing, and the type of microorganism corresponds to the brain level of the organ or tissue. So old brain healing will be related to fungi or TB bacteria. Midbrain would be bacteria, and new brain are viruses, which Dr. Hammer doubted the existence of viruses. And now we have something called exosomes. And it's Dr. Kaufman, Kaufman, and he's reframing the whole COVID story as exosomes, and this dovetails perfectly with how we explain flus in German New Medicine, but I'm not going to get into that. So using the chart, the infections would only be in the healing phase. In the active phase, when we have an overflow of cortisol, that protects us against infections. And actually, our bodies will start collecting bacteria for the healing phase during the active phase, getting ready to heal. It's quite amazing. So people who have TB bacteria, but it's not active. Finally, going into Law 5, it's an overall philosophical summary of all the laws. To undo my joints here. Sitting on the floor, unfold my legs. Okay, so diseases are special programs of nature designed to help the individual or the species. When we get through a healing phase, we are stronger. Example, bone cancer. Allergies. After we get through allergies, we're more resilient to environmental toxins. And the significance of all of these laws together is that we can learn to trust our bodies and allow them to heal with a minimum of intervention, saving time, energy, and money. And I often mention that our clinic saved OHIP our health insurance over $2 million, mostly in cancer treatments that were no longer necessary. And patients outlived their prognosis by years and decades. So what I've really found the German New Medicine to be real and effective, and my patients show that to me regularly. Because this is very important also. If you go on the internet and research German New Medicine, you'll come across a lot of people who vilify it. And some of those people are related to organizations that would be threatened by this, and other people don't understand it. It doesn't make sense to them. And I have to admit, it's very counterintuitive to everything we thought we knew about disease. So it's understandable. It's like the earth is round and not flat for medicine. I mean, the earth looks flat. You know, the healing phase looks like a disease. I mean, some cancers are in the healing phase. You leave them alone, they stop by themselves. So, but again, very counterintuitive, very scary. So how do we use this in practice? So the fundamental thing is that the person understands at least the 5 laws of German medicine, but especially how they apply to their condition. They don't have to know all the thousands of details that Dr. Hammer found. So for a person's condition, you want to assess the type of shock. And that's the beauty in German New Medicine. Every tissue and organ in the body has been mapped for the type of shock associated with it. You also have to determine which phase the person is in, because if they're in the active phase, you have to actually resolve a shock to move forward. And people may need help with this. Sometimes we have shocks that are very old and deep. And sometimes, and I should have put this on the slide, it's not good to resolve a shock. Sometimes the healing symptoms would be too much for a person. So it's good to talk to somebody who understands German New Medicine to see, could this be the case? This is something that gets very, very complex in practice. Now with joint pain, you can absolutely do a lot of this yourself. But when you get into things like cancer and some of the other conditions, it's very important that you know all the technical details. So that's if they're in active phase. If they're in a healing phase, people have to understand the symptoms and how to ride them out. And you can use whatever works. So I am not a purist. Sometimes some of my patients use pain medication. And whenever possible, we try not to use it. You can use homeopathy, use nutrition, you can use Reiki, you can use body work. Energy work is fantastic. And a big part of using German New Medicine is cultivating a process of self-awareness. And this is especially important. Well, it's important for all the programs, but for joint pain, you'd be aware of when we get triggered into self-devaluation. And usually, of course, that starts in our childhood. And we carry our parents' voices around in our head. And we have to not have that, not just accept that. We need to challenge that and start to learn to talk to ourselves in a different way and notice when things trigger those phrases and how to say something different. And so, again, these things can be even transgenerational. They can be this, is making it sound maybe too easy. For some people, this can take years. It's deep, multi-generational, and it can come with, families coming out of war zones, out of, major heavy shocks. So one has to be quite careful. So counseling and talking. Hammer always said, when you have a shock, talk. Don't let it fester in the body. As soon as you start talking, the body realizes that you're taking responsibility for it. You're doing something about it, and it won't need to fester in your body. Meditation. Meditation is a lovely process for both calming the mind, so making us less susceptible to shocks, and so more resilient, and it also deepens our awareness of ourselves to which shocks we're holding and where they come from. And keep studying. Like even after you've learned it once, keep learning, keep taking courses, because that's how you get stronger and stronger in this new healing paradigm. Okay, summary of joint pain according to German New Medicine. I think we've gone over that a few times now. I'm going to go back, get into something else. So naturopathic mechanisms of joint pain. So this could be a multi-day course. So I'm going to just mention these. So the liver being congested is often a piece of a mechanism that contributes to hanging healing of almost anything. Because the liver does so many things that when it's congested and not functioning well, it contributes to the overall irritability of the body, including joints. So in other words, it's not able to catch all the particles in the blood. So these particles are circulating, and of course they'll make a joint pain worse. Digestion, pancreas, our biome have all been very well researched as being implicated with arthritis. So again, similarly, when we're in chronic stress, we don't digest very well. We don't break our food down very well. So again, we get particles in our body that irritate. And our biome, our gut flora gets unbalanced. And our gut flora make a lot of nutrients that we need. Our adrenals get exhausted or are too wired. And of course, this controls our cortisol level, our ability to control inflammation, or they get so exhausted that we can't even have a healthy lifestyle. Other symptoms include lymph, colon, our mind, skin, blood. I also use the blood type. So different blood types have diets that are suited to them. I use the Ayurvedic types. Different Ayurvedic types have actual different mechanisms of joint pain. There are different nutrients that we use in naturopathic medicine to repair joints. They're often raw materials that the joints need to rebuild themselves. So collagen for the cartilage, glucosamine, minerals. And of course, lifestyle is major. Movement has been correlated to a major improvement in joint pain. Just to have regular, gentle movement. I remember there was a research study where people decided to walk to work. And I think 70% of their joint pain collectively got 70% better just from the movement. So I think we have to be careful not to make everything emotional, those of us who are in German New Medicine, and make sure that we keep the emphasis on these lifestyle pieces that are so important. Sleep is utterly important. If we don't sleep, our body can't repair. Weight is usually a symptom of something else, but it contributes to joint pain. Food. I can't see the rest of it because it's under our pictures. Other pieces that we refer to in doing naturopathic assessment would be allergies. But of course, allergies are mostly symptoms of liver, digestion, and adrenal. And also allergies can be tracts in German New Medicine. So we can treat allergies quite well. And foci. So focus is in medicine, in holistic medicine, is a subclinical infection typically in the sinuses, in the tonsils, in the, there are 4 places, in the teeth, and I think in the gallbladder, that can cause a chronic imbalance in the body. So we test for those kinds of things. So, but what I do is I usually test for basic things first, because if the basic things are totally out of whack, then it doesn't make sense to get complicated and very, very esoteric in a way before the basics are cleared. Diet in line with German New Medicine. This is very interesting. I learned this over and over again from my teacher, Ilse Dora Laker. And she continually tells me, don't fast or detoxify in the healing phase. And I've added here, unless you have a very strong body. She also always says, eat adequate protein and nourishing foods. And the reason for that is that the body is usually depleted after prolonged stress. And if you have too many greens or supplements that push the body into detox, you can have a detox reaction. And the person will never want to detoxify again. So I always check people through pulse, through tongue, and through a blood pressure test that I do, lying and sitting, to see if they are strong enough to detoxify. Diet according to naturopathy and Ayurveda. So the first way that we decide a diet is by condition. So in other words, if the person's diabetic, we will make sure that they have a diet that works for the diabetes first. Or if they have heart disease, we'll do for that. Or if they have allergies. And then we look at the constitutional type and strength. And I use the Ayurvedic types. So Vata being thinner, more sensitive people. Pitta being medium people with a lot of fire, a lot of energy. Kapha being well-built, strongly built people, they tend to be calmer. And each of these need a different diet. So Vata needs a cooked diet that's spiced because they don't digest very easily. Pitta can have the most varied diet but needs to avoid stimulants because they're already pretty stimulated from inside themselves. And Kapha people need a very a minimal diet. They do best with eating the least and eating foods that are also can have spices because they tend to have low digestion, but foods that are low fat because they tend to put on weight quite easily. They do very well with not eating very much. Their body just hums because they congest very easily. Also use the blood type. So I had a recent case where I had a patient who went home with his own blood type diet, and his wife was so impressed by his results, she went out and got her blood type done and started to follow her diet. And within 2 days, the arthritis that she'd had for 20 years was gone. She was pain-free for the first time in 20 years, just from doing this diet. So somebody had asked me at the beginning, how do I start? Well, if it isn't obvious, or even if it is obvious, what your devaluation is that caused your joint pain, using these lifestyle tips will only help it go faster. There's general eating guidelines in naturopathic medicine and Ayurveda. So the biggest thing for eating, the biggest things are not to eat when we're stressed, easier said than done, and not to eat too much. If we can do those 2 things, what we eat is not as important. The other thing is not to have too much water with a meal. Half a glass of water, warm is even better, is great. Ayurveda actually recommends half a cup as opposed to nothing. and to stop eating as early as possible in the evening so that your body has a chance to digest and metabolize, use the nutrients for repair, and then go into detoxification. Changing your diet when not to. I've become so respectful of changing people's diets. It is, I mean, when I first started practicing, my diets for cancer were worse than chemo, I swear. And it's a big deal. So we have to be careful not to unbalance ourselves by changing our diets too quickly. And when not to change the diet, we have to be really careful when we're pregnant or breastfeeding. When we're under extreme stress is not a good time to do a big diet change. When we have extreme mental and emotional illness, also, we tend to medicate for that, and it's like taking away a drug, like going off a drug too soon. So we have to be careful to respect how we cope and build our coping mechanisms to where we can easily let go, to not shoehorn ourselves into a diet. To do a diet that's not easy is like pulling an elastic band and holding it, and then eventually it relapses. So I really try to get people to make the easy changes. I'll sometimes give them the blood type diet, and I'll say, just play with this. Just experiment with it. So there's no pressure. It's a game. It's a play. It's fun. And that seems to be working extremely well. Detoxification. So joints respond extremely well to detox when the time is right. And so I'm just going to go over this quite briefly, but you have to make sure that you're not contraindicated. So it's pregnancy, nursing, stress. Even if you have an illness or on medications, you should work with somebody first as you learn to detoxify. What I try to do is I try to teach all my patients how to detoxify and the principles. Pick a time when you can relax. Detox will not work if you're stressed. When we're stressed, our muscles have this a certain level of tension that doesn't allow for things to flow very well. And we'll get a detox reaction, which is very unpleasant. We feel irritable, we might get headaches, the joint pain might get worse. So it's very important to be able to be relaxed when you detox, or just do it so gently that the body's almost not knowing. You sneak up. And note the seasonal effects. So spring and fall, our bodies naturally detoxify. You have to make sure the bowel movements are working well, because that's where most of the toxins are going to go. So if the bowel movements aren't working, again, you'll have a rebound reaction. Lighten the diet, and I'm saying start slowly. You can add supplements. My favorite supplements are milk thistle for the liver. It's very, very safe. And psyllium and clay for the adrenals. Add in emotional work. It's a great time to do emotional work when we're detoxing. And spiritual inspiration. If you have a spiritual path, or you can do detox or fasting for spiritual reasons, I find I'm almost carried when I add that element in. Much, much easier. For instance, I can do vision quests, 3 days, no food, no water, but because it's for spiritual reasons, totally easy. But then I try and miss a meal when I'm in my everyday routine. It's like pulling teeth. How to detoxify safely. I'm not going to go into that right now. Daily cleansing and lifestyle routines for joint health. Especially after cleansing, it's much easier to make changes in lifestyle. So, I mean, you can go over this slide. You'll have this for yourselves, so you can go over it. It's more of the same. Again, for the German New Medicine purposes, part of the lifestyle would be, again, I'm going to emphasize emotional awareness, positive self-talk, continuing to study German New Medicine, and a spiritual context to one's life helps everything, however that door is for you. So that's pretty much, I mean, that's kind of a beginning layer for joint pain. And to go further, so resources for German New Medicine, I've written a book specifically, I tried to make it really understandable for people who are new to it. If you want to work with me, there's an online screening questionnaire, or you can do an assessment with me to make sure that you're a good candidate, or I'm a good candidate for you. I try not to take people who aren't. I try not to waste their money. Study German New Medicine yourself. I've nagged over and over about that. So here's my teacher's website. And I have upcoming webinars, German New Medicine in Cancer, November 4th. And there's a summit, a worldwide summit put on by USA GNM on Saturday, October 17th. So if you sign up for the newsletter on our website, you'll be notified of these dates with links. Other resources, Ayurveda. I love Perfect Health, the book by Deepak Chopra. It's an Ayurvedic Bible that works your whole life. It has the questionnaire, it has health tips for every body type, and it goes right into the spiritual layer of living. Then there's a website. It's for products, so they'll try to sell you things. They're good things. Banyan Botanicals. They also have questionnaire and information. For naturopathic medicine, you can contact your local organization for referrals, and always tell people, call the person before you go. Make sure they're a good match. You should really like your practitioners, or trust them at least, or think that they're quite competent. Mercola.com has tons of information, also tries to sell you things. Dr. Weil, another holistic doctor. There's our website for consults, the healing stays, if you want information, the webinars are there. And Eat Right for Your Type, that's on the blood type diet. There's the book and the website, because you can start with that on your own if you like. So after all of that, we're at questions and answers, and Rebecca is going to take over from here.
Thank you so much, Catherine.
My pleasure.
That was great. So we've had a few questions put into the chat, so we can start with those, and then people can add in any other questions that might come up for them. So the first question that we had on the chat window was from Annalise, and she was wondering, when you were talking about doing the hair analysis, that if somebody colors their hair, how can you do that test?
They tell us that we can still do it. It should be a week. It should be not within the first week of coloring the hair, though. They burn the hair. So, well, they wash it and kind of put it through a cleaning process. Yeah, so they tell me that that's still okay.
It still works. Okay. Annalise, does that answer your question, or you can go off of mute if you like, if there was something further you wanted to ask about that?
Great. Clear satisfaction.
Excellent. Okay. The next questions were from me. So as I was thinking things, I was putting stuff in. So I was a little confused as to when the 6 to 8 weeks is how long it should be in the healing phase, and that's how long it should hurt for joint pain.
Yes.
And there was, I guess, this hanging healing idea is the thing, and I think you mentioned more than one way a hanging healing could happen.
Yes.
So that the joint pain would continue.
Yes.
So and one of them was a re-trauma, right?
Yes.
Where you are feeling devalued even because of the pain.
Yes.
And what were the other ones?
I mentioned two more. One is how we're thinking about the pain. So we're thinking about the pain as a disease, as a scary thing. So we're doing this around it. We're clenching around it. We've been told by our medical doctor that there's no treatment, that we're on drugs for the rest of our lives. And so we're stressed about it as opposed to relaxed. And that stress, that holding, tends to prolong it. The other one is using drugs. So usually the drugs for joint pain are anti-inflammatory. And so the inflammation has its cycle and it finishes. So the drug stops that and it can't finish itself.
Okay. So on your number 2 of those, just as a follow-up thing, then
Yep.
if you're not letting yourself fully relax and you're staying in too much of a sympathetic, is it a parasympathetic state, then it doesn't ever get a chance to really go away.
Yes. I mean, I had a very interesting experience with a cat about that. And I want to share this because it was so profound. So I had a cat with eczema, the worst eczema I'd ever seen on anybody. It was on the cat's back, usually where I patted it. And I totally forgot everything I knew about German new medicine. So why is this cat so sick? For a week, just noticing it had gooey pus. And the cat was not bothered. The cat seemed totally fine, wasn't bothered by it, so I didn't treat it. And then I was sitting down wanting to pat the cat and then realized that the cat had been away for 3 months at a place he didn't like. It was with a dog. And he had been back home for about a month. And I realized that eczema, as I mentioned with my patch, is a separation issue. But the rash happens in the healing phase. So I realized, and where you're touched, right? So the cat is healing this terrible separation, and the intensity of a symptom will reflect the intensity of the stress. So I had this huge revelation, like, oh, I've totally been thinking about this wrong. I've been thinking that, oh my God, why is my cat so sick? I went, oh, it's in healing. The next day, and I would never have guessed that this could be, it was 95% better in one day because of how I was thinking. I was clenching because cats and children are affected by how we think about them so profoundly. It was a huge lesson for me, but it goes for ourselves as well. But this was an external reflection of how thinking can affect the course of a disease. I've seen it actually also in a child. When the mother relaxed her hold, the child had a supposedly incurable skin disease. And as soon as the mother realized what it was and that it was a healing, the child was healed within days, completely.
That's great. The next thing I asked in here was the research that Dr. Harmer did. Is that all captured somewhere, and is it available for people to read?
Not yet. It's mostly in German, and bit by bit, it will be translated. So the USA GNM people are actually in the process of translating some of his work. So if one can contribute to that. Ilse-Dora is in touch with Hammer's widow, and they're going to be setting up an organization that will complete all the translations. It's thousands and thousands of pages, huge reservoir. I mean, the complexity that this goes into is unbelievable.
That's amazing.
Mm-hmm.
Yeah, that'll be really fascinating to have it translated.
Yeah, it will be.
Okay, so then we had a couple questions from Lori. She was asking, how do you view people with Lyme or young children with severe autism and layers of toxicity?
So Lyme is how we deal with Lyme is that we look at each symptom and correlate it to the shock. So Lyme, chronic Lyme, not acute, chronic Lyme is actually a combination of shocks, not in German new medicine, in that paradigm, not a result of the Lyme bacteria, the Borrelia itself. And I've actually seen this in my practice. Someone had Lyme disease for 10 years and was about to move to the States to get better medical treatment for her Lyme. And she was 50% better in 5 days using this different angle for it. It was interesting because I went to a Lyme conference thinking, I need to understand this better. And none of it made sense. Even to them, it didn't make sense. They admitted, the testing doesn't really work. So if you have this and this disease, you just throw this at people. and that wouldn't work half the time anyway. So it's not a consistent story, the chronic Lyme story. When I watched, I'm quite interested in this actually. Thanks for asking. I watched one of the Lyme documentaries, and I saw these people with chronic Lyme, and I went, oh, that's that German New Medicine program. That's that German New Medicine program. We don't know these yet, you see? So every few years, there'll be a new wastebasket diagnosis: Candida, chronic fatigue, Lyme disease. And often it's these chronic healing symptoms that are in hanging healing from German New Medicine. So I think we have huge, in every direction, German New Medicine will help us. And with autism has a very specific cause in German New Medicine. It's a constellation. It's a combination of, and I don't remember exactly which two it is. They are. And there are also quite a few naturopathic things that I would definitely say, make sure you investigate. So there seems to be a definite relationship to vaccines. Now, my teacher would say it's not the vaccine itself, it's the shock of the needle, underlined by the parents' fear of the vaccine. That's predisposing the child to being shocked. So it's very interesting for those of us in the holistic field to look at it from this angle, because of course we're looking at the vaccine and horrified and has all these toxins, but most kids don't react to them. Most kids don't have major problems with them. The holistic families who are already biased against them, right? Not that I think vaccines are a good thing. I don't. But there's a different mechanism as well. I think the toxicity also has a part. It's more of a chronic, debilitating, children are sicker and sicker with chronic things. But these big dramatic shocks, these big dramatic pictures of these kids suddenly losing function could easily be a German New Medicine. And I don't have a lot of experience with that. I don't treat autism, or it just hasn't come up in my practice much. So that's all theory. I want to be really clear about that. But it's some very titillating possibilities.
Lori, did you want to follow up anything on either the Lyme or the autism?
It's very fascinating. Wow, it resonates strongly with me. And one of my other questions was, you speak the exact same language as the doctor that I've been working with for 15 years, Dr. John Coombs in Perth. Do you know him?
I love him. Yes.
He's amazing.
Yes, he's wonderful.
Yep, he's changed our lives, and he's phenomenal. The stuff that we've now researched together, helping the children with autism, and his viewpoints, and he's just brilliant, right? So I'm wondering, how some of the stuff that you're talking about, is he I'm gonna go follow up with him. Does he have an understanding of it, and to what extent would he integrate it, or has he already into his practice? I'm just curious.
No, I don't have a personal connection with him right at the moment. Okay. I've been pretty isolated doing my own work. Of course, part of my process now will be now starting to move out and starting to network and starting to see who I can play with, who wants to play, who wants to collaborate, to move forward.
He's very much on that same page because he's semi-retired, and I am definitely going to go and chat with him about you and talk about your book and see how he knows, because he's extremely well researched and he loves going down rabbit holes of all new stuff that's popping up for the children, right? And every year he goes, I'm going to retire, and then he can't because he has so many requests, right? It's an epidemic of children, and the people are just reaching out, can you please help us? So
well, if he wants to come visit, tell him I'll give him a copy of my book.
That's what I was going to say. I'm definitely buying your book. I want to know more.
So yes, the book is available at Eco Wellness
Okay, done.
Amazon.
and Amazon. Yes.
Yeah.
I'd rather buy it at Eco. Yeah. Yeah. Okay. Oh, that's wonderful. Yeah.
Lori,
Okay.
you had one other question. What emotion or elements to work on would be associated with strong menopause, hot flashes, insomnia?
Yeah.
So what happens, these are some very valuable things that I've learned from German New Medicine about menopause, is that when many people have childhood traumas. So then when we go through puberty as women, and men too, boys too, our hormones go up. We go into reproductive phase. And those hormones are semi-protective of us. They make our traumas, they almost blur them to some, they make them harder to access. It's almost like they suppress them. So we're in kind of hormonal mode, and we're having babies, or we're creating businesses, or we're doing whatever in our reproductive years. And then as we get to andropause and menopause, those hormones go down, and those unresolved traumas from childhood, if we haven't been working on them, because we still can work on them when we're in reproductive years, hit us. And for people who are unprepared, they hit us like like car into a wall for some people. Especially because childhood trauma blows adult fuses. For a child, some of the traumas we experience are life and death, like an abandonment or a separation from our parents over a certain period of time. We think we're going to die. That feeling in an adult is totally debilitating. So there's a general pattern here of traumas resurfacing. And so part of those symptoms are sympathetic, not being able to sleep, not being able to eat, being agitated, being anxious. Together with a lifetime of stress, adrenal fatigue, not producing enough hormones to supplement the lowering hormones in the ovaries, a congested liver, because most of us never detoxify, but can't balance the hormones that are there, and all of that together. And then you look at any specific symptoms like joint pain or any other symptoms, and you can match those to more specific, what are the specific shocks? Or, even mental constellations, mental patterns, to try to tease out what are the shocks. And at this point, when we've been carrying a shock for decades, sometimes it's not safe at this point of our knowledge, to resolve every shock. Sometimes the healing phase can be dangerous. So it's really good to work with somebody who understands German New Medicine well. So those are some of the things I've learned about menopause.
Did that answer your question, Lori?
What was the last part? Because it totally cut out here. My internet was spotty. You said something about healing phase and dangerous?
Yes, when we've been carrying an active trauma for decades, the repair phase, the healing phase, can actually be dangerous. So we have to be careful. We have to really study German New Medicine, or if you're a practitioner, you have to know it well to work with people who are severely traumatized. And if you're the patient, then you also need to know it well. You need to work with somebody who knows what they're doing. In some cases, I will not take them. I am not, studied enough in some things to take them on. That's why I do my screening.
Okay, we'll go on to the next one from Carrie. She asks, what if there's not a memory of a shock we can find associated with the onset of the joint pain?
Good question. So you can still heal it. That's the most important news. And so what you can do is notice the devaluation thoughts you have now and start to heal those, plus doing the physical things for the joint, and it will heal. For most people. Again, some people have such deep traumas, you know, I think, although I say that, and I also at the same time see that we're increasing our understanding of energy medicine. And I've seen such miracles with energy medicine, things as simple as Reiki, that my hope is that even though German New Medicine is based on the body and the material plane and has these timelines, with energy medicine, we can supersede those and make them faster. But I think this will be now the next stage of our medical evolution, is integrating this and learning how to work with all of this together. It's very exciting.
Carrie, did you want to follow up on that at all? Oh, you're all good? Okay.
Unmute. Yeah, that was wonderful. Thank you, Catherine.
Yeah, you're welcome.
Okay, and so the next was Annalise has said, Dr. Hammer's book and CD, and I've listened to the CD repeatedly in the hope that my joint pain would go away, but it didn't work. Does that surprise you? Does GNM address tinnitus?
Pardon me? What was the last thing about tinnitus?
Does GNM address it?
Yes. Yes, it's part of a hearing conflict. So, but I'm not surprised. I mean, I'm laughing because I can't stand listening to that CD. Some people really like it, and other people, like me, just couldn't listen to it past the first rendition. So
he's not a singer, okay? Let's face it. And I thought if I punished myself by listening to his original version over and over and over, you know, I'd heal.
Right.
And I thought, oh, come on, I did a good job of listening. Come on, help me out. But it didn't work.
Listen to the word punished and think about self-devaluation.
Maybe I didn't have the right attitude.
Maybe.
Maybe. Yeah, I think I'll have to come see you again, definitely. I'm in a better place now, I think.
Great. Me too.
Yes.
Just keep learning, right? We all keep learning.
Oh, yeah.
Right.
And Dr. Willow, are you still doing the once a month meetings that you just do discussions on German New Medicine?
I haven't been doing them since COVID hit.
Maybe you could do an online version of those. We should think about that.
You're right. And actually we could do that. I've been doing them with Sandra Hauch, who's also on here. Yeah. She's also a student at Ilse-Doris, and we've been doing them together. And you could join us. You could host. Yeah, we could do that. It's very good.
Yeah, let's talk about that idea. That'd be fun to do.
People could just keep asking questions.
Yes. Yeah, or it can just be very, yeah.
And we can do it by donation, so it's accessible to everybody, or charge very little.
I love that idea.
Let's do that. Okay.
Let's do that. Let's set that up.
Thank you.
Yeah, I'd like that a lot. Does anybody else have any other questions before we close up for tonight? I think that we're all good to go then.
All right.
So we'll do just another quick little sound piece to close up then, if everybody sounds good with that. All right. Just getting ourselves comfy, taking a deep breath, feeling into our hearts, feeling the gratitude, letting ourselves relax. Peace and love and blessings to you all.
Thank you very much.
Thank you, Catherine.
Okay, I'm going to stop the recording.